Hey guys, I am Dr. Cade and I am sitting here ready for a long overdue video to do with you guys. So today we're going to talk about chiropractic. This is going to be a big one. So thank you for joining me. Thank you for taking the time to do this. It's going to be long. I'm going to try to talk fast, but I'm going to try to bless you with as much information as I possibly can. So here we go. That's me. Founded LIFEstrength Health Center down here in Naples, Florida back in 2010. There is my crazy family. Love you guys so much. Yeah, absolutely. Beyond blessed to have this family. So thank you, Lord, and get to work next to my best friend. He's not joining me on this video. Unfortunately, he always brings lots of knowledge and lots of fun today. So thanks for who you are, Coach. There's his family, and you can expect to see all of us at LIFEstrength Health Center. So again, we are talking about chiropractic today, but we call ourselves a health center, meaning people come into our office with a little bit of everything. Our job is to help people get healthy and well. It's not to adjust them, right? Chiropractic is just one of the many tools that we have. And today we're going to be talking in depth about that, along with some of the other tools that we use in our office. Okay, so I'm going to get my face out of here as I start to jump into things a bit more. And let's see how this works. There we go. We went full screen. Okay, so again, with what I just said about the tools that we have, we aim to be a blessing. I think the biggest thing that we can ever give anybody in this office, the biggest blessing we can give anybody is actually not the adjustment or a supplement, but it's the understanding as far as what is going on with your health. That's our number one job, is why this is happening, so that we can set you free and you can live the life of your dreams. So let's have a little bit of fun before we jump into things. A wise man ought to realize that his health is his most valuable possession. Unfortunately, most of us don't realize that until it's too late, right? Or, most of us are paralyzed because there's so much information out there these days. We always do a free 15-minute consult. It's that if that's you, if you're not a patient at this office yet, and you don't have to be in Naples, Florida to do that, you can be anywhere. Our job is always to help you. These are the pillars of health to which we stand on. Again, we already talked about chiropractic, which falls into the neurology category all the way down at the end there. We got a few standing on top of that though, don't we? We've got stress, we've got sleep, food and hydration, toxicity, movement, and blood work. Those are all the different avenues, the different tools that we jump into. And if those things are well, then you're well. It doesn't have to be a mystery, but if those things aren't working right, then there's an issue, right? So again, if you get those right, you can enjoy a lifetime of amazing health because you are wired to heal. There's Coach Kayson's book. But if you don't get those right, or if you maybe ignore some of those, or you prioritize one and don't pay attention to the other, there's a price to pay eventually, right? Because you can't negotiate with Mother Nature. Those are the principles of timeless health. Those are the things that all of us have to play by the same rules with, right? We always love to say that the greatest doctor in the world lives inside each one of us, right? The greatest doctor doesn't live on a beach in Mexico. Lives in each one of us. And so our job is to amplify that doctor inside of you, that intelligence inside of you that governs everything. And again, we're going to connect that with chiropractic today. It's going to be a lot of fun. So here's our goals today. This is really hard to answer these questions in a video like this. Most people coming to us at this point are asking the question, what's wrong with me? They're asking us if we can help them. And of course, if we can help them and we figure out what's going on with them, they want to know how much it's going to cost and how long it's going to take. So here's where I'm going to stop and what I'm going to say. I'm probably not going to answer much of that today, right? Because I can't answer what's wrong with each person that's coming to our office in a video like this. So what we're going to do is answer a bunch of other questions. And when you meet with me one-on-one, those are the things that I'm going to answer. Okay. So what I want to do today is cut through a lot of the garbage that's out there about chiropractic, give you clarity on how chiropractic may be able to help you and your family, and give you confidence in the right action steps going forward, whether it's chiropractic or beyond that. Right. So again, a couple more silly quotes. Love this one by Mark Twain. Yes, the author Mark Twain actually wrote this. Be careful about reading health books. You may die of a misprint. So in our modern day and age, I kind of tweak that a little bit. Be careful about reading what's online. You may die of an advertisement. You never know who's putting that information out there, right? So our job is to get through the misprints, right? Our job in this office is to get through all the advertisements. Our job is to cut through a lot of the garbage, right? And to be able to share that with you. And that's why we've created those pillars. Okay, so to continue plowing forward, I'm going to ask a couple silly questions here to paint a picture. We live in the greatest country in the world. Are we healthy? or are we sick in 2026? So let's go through a couple statistics that unfortunately are not new. America, if you took the top 37 developed nations in the world, we are dead last in terms of overall health, which is really, really sad. Cancer, from the American Cancer Society here, for women, 1 in 3 women get cancer, 1 in 2 men get cancer. Wild statistic. Heart disease is 1 out of 3 people will die from heart disease, according to the American Heart Association. CDC says that 1 in 2 people will have diabetes in their, 1 in 3 people will have diabetes in their lifetime. Autism, that number continues to spike across the country, but California has the highest number, and it's now officially 1 in 19 boys. And blockbuster drugs continue to go up. I think we could choose a handful of those, but one of the biggest ones is Humira. That's a lot of zeros there, $12 billion. Humira, the autoimmune disease drug, anti-inflammatory drug, Humira, rakes in that much cash every year. But while we're lining the pockets of a lot of people and slinging a lot of medications, are people actually getting healthier? And I think these statistics show that we're not getting healthier. So the scary part for me that I'm starting to see, and maybe many of you are too, is that being sick is starting to just become something that we're accepting and that it's normal, right? And I want to remind you that it's just not normal, right? These medications, these doctors, right? Like we need to be counterculture. We need to think differently, and we need to do things differently if we want to end up different than everybody else and different than these statistics that I just showed you, right? No one's coming to save you. No drug is coming to be a magic cure, a magic pill, right? We've got to do the hard work ourselves. And it starts with changing our mind and changing our perspective, changing the lens to which we look through the world. Being sick is not normal. It's not something, it may be common, but it's not normal. Again, going back to what I said, most people don't do anything about their health until they lose it, and they don't realize just how important it is. I think this quote by Thomas Fuller is just awesome, right? We don't have to wait until we're a statistic, just like the rest of that shows. We don't have to wait until we end up like everybody else to do something different, right? So I love the idea there that a smart man learns from his mistakes, but a wise man learns from the mistakes of others. Okay, so one of my favorite questions to ask, not just in what you're maybe coming here with to our office, but in life, is why? Why is this happening? So you're going to hear me ask that question a lot. Instead of settling for cancer, right? Instead of settling for arthritis, instead of settling for you fill in the blank of the disease, we are always going to ask, why is that present in the first place? So again, let's just kind of run through a couple more questions here. Why are you having a headache, right? Instead of just covering it up with aspirin or ibuprofen, why is that headache there in the first place? Why is there pain radiating into the left leg? Why is that happening but not down the right leg? Why is it in that specific pattern? Why is there arthritis in your neck or your knee, right? And these continue to go on and on. One of the big things that we always love to ask is, why does cancer run in your family, right? We kind of settle for this idea that so many of these things are genetic, or maybe even my neighbor has it worse, so I'm just going to cover it up for now. But it's so important to ask, why are they there in the first place? You know, your body with these symptoms the symptoms aren't the problem. Your body is just using the symptoms to tell you something's wrong. And sometimes it has to yell at you loud enough to get your attention. Pain is a really good attention grabber, isn't it? You know, a lot of times when the pain is bad enough, your life has to just stop until you can get back to less pain, right? But the problem is, if we're just treating the symptoms, the pain, and we ignore what's actually causing that, we're just waiting for that problem to get big enough that the medication won't quiet down that scream anymore, right? So if you listen to your body when it whispers, you'll never have to hear it scream. It's so important to listen to your body, you guys. It's so stinking important, instead of just quieting those symptoms. Every symptom has a reason why it exists. And again, that's our job at LIFEstrength, right? That's our job, is to figure out why the symptom is present. So one of our really, I was going to say favorite things, but really it's beyond our favorite thing. It's the only thing, right, that causes problems in our body is this: stress. Every single problem can be driven back to this, or I don't know what the right word would be there, followed back to stress. There's 3 types of stress. There's mental stress, there's chemical stress, and there's physical stress. Most of us only really think about physical. We're going to talk about all of these things to some extent today. We are going to focus on the physical. We're going to see things today on an x-ray. We're going to talk about that quite a bit. But if all we're talking about is physical and we ignore the ideas of chemical stress or mental stress, we can only get so far with our health. So when we have a symptom in this country, instead of looking back at these three things and addressing them, what's our gold standard in this country, right? When we have blood pressure or high blood sugar or a thyroid that's out of control or elevated or imbalanced cholesterol or cortisol that's spiking through the roof, or again, going back to pain, the gold standard of our care in this country, the best doctors out there, what are they doing? For every one of those, we take a pill, right? When you walk out the doors of that medical industrial complex, this is the only solution they have. Well, I guess if that medication doesn't solve it, then the next step is surgery, right? Or maybe before the surgery, it's a specialist with a special medication. I don't mean to downplay it because there's wonderful people that, saving lives every single day. And I'm not talking about emergency care. I'm talking about chronic issues like the ones that I've got listed here: elevated or dysregulated blood pressure or thyroid that's dysregulated. These things are all chronic issues that are caused by this stuff here. And again, if we fail to address that and we're just using medication to cover it up, again, there's a price to pay. Love this quote by William Osler: "A person who takes medicine has to recover twice, once from the disease and once from the medicine." It's awesome. What a great quote. Love this one by Dr. Perlmutter: "We've been focusing on the smoke while forgetting the fire. The symptoms of the smoke are the symptoms of the fire are just the smoke. The fire's the problem. We can, fan the fire out all day, right? But if that fire is still going on, we're going to continue to have smoke." Symptoms and the actual root cause, same exact thing, right? Okay, so are there other options for all of those symptoms I listed and more instead of medications and surgery? Are you sick of getting stuck into the medical industrial complex? There are so many options out there between doing nothing at all, and doing surgery or doing a medication. There's a ton of them. And again, our job, once we figure out what's actually causing these symptoms, what the root cause of this is to give you as many options as possible, right, towards alleviating the root cause between doing nothing and doing medications or surgery. So again, that's what we're after today. So love this quote by B.J. Palmer. Lots of quotes today. "Medicine is a study of death and disease and what causes man to die." Oh, that's harsh, but it's the truth. It's all about death and disease. And chiropractic, or functional medicine, is the study of life and health and what causes man to live. So stinking cool. So we're going to talk about these kind of natural ways that chiropractic activates the endorphin system. Studies show the endocannabinoid system internally is activated by the adjustment. It helps optimize and balance serotonin, dopamine levels. It helps to, these pain pathways in the neurologic system, it helps to activate those and decrease those. So, if I'm going to say something about chiropractic before we jump into the details of it today. I think one of the biggest takeaways today is the adjustment what it does is it helps lower stress in your body. And when there's less stress in your body, less mental stress, less chemical stress, less physical stress, your body heals faster. At the end of the day, that's what the adjustment is doing. It's decreasing stress so your body can heal itself. Your body's ability to heal is greater than anyone has permitted you to believe. And ain't that the truth? We are always focused on this outside in. I need a medication. I need a doctor. I need a practitioner. This mentality. But at the end of the day, the greatest doctor in the world lives inside of you. All right, I'm going to keep going. Again, if you are tapped out already, I'm going to apologize because I am just going to keep on throwing stuff at you. So hang on. Let's have some fun. All right. So, what is chiropractic? That's the talk today. I think most people think that chiropractic is all about bones. And most people think that we're bone doctors. Most people think that we're pain doctors. That's usually the things that drive people into our doors. But man, chiropractic is so much more than that. So I love asking questions. If you can't tell, what part of the body is the most important organ that we have, right? Love asking that question. What's the most important organ that we have? And I get this answer a lot. Most people think it's the heart, right? But what part of our body tells the heart to beat? What part of our body tells the lungs to breathe? What part of our body tells our toenails to grow? Or when we eat an apple, what part of our body absorbs that apple and turns some of that apple into, you know, a kneecap or an eyeball or an eyelash? It's so wild. What part of the body controls everything else? Well, it's the nerves, right? It's the brain. It's the neurology in the body. That's the master control system, right? The nerve system is king. And that's what we're going to drive through today. Think about this. We could eat the best food in the world. We could be on the cleanest diet, all organic, whatever you want to say, no seed oils, all the stuff, right? But if we cut the nerve that goes to the heart, what happens to the heart? Immediately. We could be drinking the best water, right? We could even go a couple days without water. We could even fast for a week or 2 weeks or a month. Some people fast, right? It's like we can live without food for a period of time. We can even eat junk food for a period of time and have minimal side effects. We could hold our breath for maybe a couple seconds, a couple minutes, maybe, right? But if we cut the nerve that goes to the heart, that heart is immediately done. Cut the nerve to the lungs. The lungs cannot breathe anymore. They can't function because the brain is no longer telling them to breathe and to pull in air. It is all about the quality of that nerve supply. So here's a good example, right? That slide kind of jumped forward and you saw this here. This is Christopher Reeve, played Superman. When he fell off that horse and his C1 moved over and it put pressure on the brainstem, it damaged the brainstem. So there he is after that injury on the right-hand side. And in his brain, he could still, kiss his wife and hug his kids. But that message didn't go from the brain down to the body so that he could do that stuff. It stopped where the damage was in the brainstem. They had to put a pacemaker in his heart, ventilator in his lungs so that those organs could function because that message wasn't getting down there to the rest of the body. Right? It's this neurology thing is what health is all about. And so many of us continue to ignore that, or our system continues to ignore that, but this is what it's all about. So let's keep talking about it. An apple. Right? Wouldn't it be nice if apples just grew out of thin air? How do apples grow? Well, they start from a branch, right? But how did that branch, before that bud could come off of that branch to form that apple, where did it have to start from? Right? It had to have those roots back to the branch, back to the trunk, back to the ground. There's a connection. You couldn't just throw a bunch of apples up in the air and expect the tree to catch them, right? The tree had to grow first. There's a sequence of things that have to happen. And then boom, we get this apple tree, right? It's exactly the same in the body. Every organ in our body is connected to the one under our hat. Let's go through this really quick. Have you ever seen the billboards, like when you're driving down the freeway, that says your baby's heart beats at, some say 19 days, some say 21 days. Have you ever seen those? It's like the pro-life billboards, right? So you can see an ultrasound here. This is an ultrasound of my oldest son, who's 12 years old now. His name is Curran. This was just an absolute glamour shot from the ultrasound, and I had to have a screenshot of it. It's just one of the coolest things for me because it's a personal thing. But I also get to see the skull. I also get to see the spine. But there's a little gray dot right in the middle of that ultrasound, and that's the heart. Again, before that, my son Curran, before his heart could beat at 19 or 21 days, whatever it is, right? Before his heart could beat, something else had to form first, right? The root to that, the branch, the twig, right, to that heart. And that branch, that twig had to be connected back to the brain, right? So it's just like the tree. We are all formed the same way. Before that heart could form, the brain had to form first. That's the most important organ. And once that brain forms and the connection, the branches, the spider webs out to the rest of the body can form. So hopefully some of you have seen this video. This is so stinking cool. This went all over social media. So here's a time lapse of neurology forming in the womb. So let's see if we can get this to play. So you can see the main spinal cord there and all these nerves branching out. Now we're upside down here. The head is at the bottom and you can see that longer, thicker, brighter nerve forming. That's the vagus nerve coming off the brainstem. We'll talk about that later in this talk, but that's the wandering nerve. You can see how far down it goes. Super, super important. Why don't we do that one more time just so that you can see it again? It's absolutely fascinating how we're made. It's so cool. It's so cool. So, when I had the slide there about it's all about nerves, I think you saw the power lines. I think most people can connect with this idea that, if we unplug something from the wall, there's no longer power there, just as if I, cut the nerve that goes to the lungs would no longer breathe. But it's so much more than just power and connection. It's life, right? If that brain tells those lungs to breathe and we cut that nerve and those lungs don't function and they die, that's life. That's our soul. That's our spirit. That's the essence, the intelligence of who we are when God breathed life into us that lives on this nerve system. And I think as chiropractors, maybe it's a little bit geeky, maybe it's a little bit dorky. I don't know. But I think that's the coolest thing is to be able to help, the physical expression of who you are at a soul level, through that neurology. That's what chiropractic's all about, is helping that energy, that essence, that intelligence inside of you connect to every organ in your body, every cell, every tissue in your body, so that there's life, right? And that it's reflected out. I think so many people get a bit nervous about, maybe kids and their immune system, but because that intelligence is in there, your body knows exactly what to do. Isn't it wild how we worry about the immune system, but we don't worry about in development that one leg is going to grow twice the speed of the other one, right? Maybe that's silly, right? But how about every cut and every scrape? A broken bone, doctors don't heal that. The antibiotic, topical ointment over a scrape doesn't heal that. The Band-Aid doesn't heal that. There's an intelligence inside each one of us that just runs the show. And that intelligence lives on the nerve system that we've been talking about, right? It controls everything, everything, everything from conception to the last breath that we have. The intelligence of life lives on the nerve system. Love this quote by Dr. Bruce Lipton. The function of the nerve system is to perceive the environment and coordinate the behavior of all cells. So we're going to jump into that, how our body has this constant interpretation, of every triumph and every tragedy of life. Our body is trying to do the best it can to coordinate its next move to be able to adapt to that and to be able to thrive to that. It's constantly changing. So in reality, the better that our nerve system, right, is working, the better we can adapt to the stress, those mental, those chemical, those physical stresses that we have. I promise you guys, we're going to tie this all in together. I promise you, hang on with me here on this ride. So when can issues really begin to that nerve system? I think a lot of people, we live in Naples, Florida. There's a lot of aging. There's an aging population here, even though there's a ton of families. It's such a cool growing population here. But I think most people think that you've got to, live a bit of life to have issues, right? Injuries and car accidents and, working at a desk or working in the field, whatever you want to say. But can they happen earlier, right? What about, baby's first year of life, right? What about the maybe starting out life with a C-section? What about the 72 vaccines that are mandated by the time that kids are 18 years old, right? What about falling off their bike and tripping over roller skates and wrestling with a neighbor, and the list goes on and on. Sitting at a desk, over a computer screen or an iPad. Kids start life out these days in our modern world with plenty of stress, right? And kids are sicker than they've ever been. Allergies and asthma and autism, right? Colic and learning disabilities. All of these things are greater than they've ever been before. Is it possible that it starts this early? What about even earlier? The EWG says that the biggest detox mom will ever do in her life is during her first pregnancy. What about the stress of perfection that mom aims for when she's pregnant, right? Making sure she's eating right and sleeping right, right? Taking care of that baby, getting the house right, all the other, stresses that mom has. And then again, our modern birth is full of epidurals and Pitocin and forceps and vacuums, right? Pain medications. Could it start all the way there even before we're born? Of course it could. Stress is everywhere. And the stronger your nerve system is able to adapt to that stress, the healthier you are. All right, so let's shift gears here, and we're going to talk a little bit about neurology. And we're going to keep it simple to start, and then we're going to jump into the deep, okay? So for your heart to beat, for your lungs to breathe, for your toenails to grow, everything starts in the brain, right? And for those messages, we're not wireless, right? We don't have Wi-Fi in our body, right? We don't have cell phone kind of receptors and signals and towers sending that out. We're hardwired. We're old school. So those messages in the brain have to go down the spinal cord. They have to go out the nerves to the body, right? And we've got two different kind of sides here to the story. We've got an intact power cord on the left, and we've got one that's been frayed and damaged on the right, right? A bit stressed out, maybe we could say. Okay, so when we've got that nice solid electrical cord, when that brain sends the message to the heart or the toes or the whatever reproductive organs, right? We have a normal function. Our body's in a state of ease. We have health and we feel good. That's a normal, ideally regulated nerve system. And that's how our body's supposed to work. Again, we're zooming out here. We're looking at the 10,000 foot view. We're going to jump into the details of this in a second. When we have a nerve system that's stressed out, or there's something out of alignment, there's pressure, there's tension, there's stress on the nerve system, when our body isn't adapting to the stresses of life, we're going to call that dysregulation, right? And so when that brain sends the message, right, from the brain down through the spinal cord out the body, if there's something impacting that nerve system, instead of our body and our organs having normal function, we're going to call it dysfunction. If that doesn't get corrected, not the dysfunction, but the pressure on that nerve system, the stress, the tension on that nerve system, if we don't get that corrected, eventually the organs that are connected to that nerve system, it's going to lead to disease, which is the opposite of a state of ease, right? Just like we talked about here. It's the opposite, disease. Our body's struggling. Of course, that's ill health, and eventually we're going to feel the symptoms of that. But it all starts back at dysfunction at a neurologic level. When we have a nerve issue, we can't out-medicate it, we can't out-eat it, out-exercise it, out-supplement it, out-detox it, outrun it in any way. When there's a neurologic level issue, we have to go to the neurology to correct it. We might be able to temporarily quiet it or distract ourselves with any of these things, especially medication. We're so good at that. There's no magic wand to it. We have to get to the root and address the neurology if there's a neurologic issue. This is it. This is it. Hopefully we're starting to connect the dots. So the next question then is, how do we test the nerve system? How do we know if there's an issue in the nerve system? I love giving people options here, because when we understand what the nerve system's doing, we're literally making the invisible visible, right? And if we're only going into this without some of these tests that I'm going to talk with you about, then we're not seeing the full picture, just like we're not seeing the full picture of this beautiful bridge here, right? We're getting a cloudy, fogged up view. And if we don't know the full picture, we're either wasting money, we're wasting time, and it's causing a ton of frustration, right? So an example of this would be blood work. Coach Kaysen in our office is a killer at blood work. He's so amazing with blood work, and he's changing people's lives every single day. It's so cool. But he has the tool of seeing the blood work is showing him exactly what he needs to do. There's no guess as far as where that dysfunction is, right? There's no guess as far as what medication or how long it's been there, the complicating factors. The blood work tells him exactly what to do. So on the neurology side of it, there's two tools. There's one called heart rate variability. Heart rate variability is a view into the nerve system and see how well it is adapting to the stress of your life, right? This is super simple. This is a non-invasive thing. It's relatively cheap. Pregnant mommies can do it. Kids can do it. Adults can do it. You can wear it on a regular basis with things like an Oura ring, right? Or a Whoop strap. These are things that give you a window into how well your body's adapting. Now, a lot of times people that are really active, like athletes or people that are in the gym, are wearing those things, but heart rate variability doesn't just go towards physical performance, but it's also tied into mental performance, longevity, your immune system health against things like Alzheimer's, dementia, cancer. Heart rate variability is such an awesome tool. Please, I encourage you to look into that. And, maybe if you go into our YouTube channel, we talk about that a bit more in depth on our stress talk. I'm going to avoid the heart rate variability talk today because I really want to talk about this. This is one of the best tools that we have in the chiropractic world for understanding how well somebody's neurology is working. So we're going to tie together today what's happening in the spine and the structure versus what's happening neurologically. I think most people, when they come to us and they ask that question, what's wrong? A lot of us are trained to think that, hey, is it a muscle problem? Is it a bone problem? Is it a nerve problem? But what I want to talk about today is that it's pretty hard to separate those things. When there's one problem, typically all the other tissues are involved. And we're going to go through some examples, looking at x-rays, looking at some MRIs today, so that you can see what I mean when I say that, okay? Let's go back to this image, right? Remember we talked about the brain's the first organ to form, then it forms that branch, the spinal cord, the extension cord of the brain, basically, and then it forms these nerves reaching out to the body, right? Well, that's the most important tissue that we have. Again, without the brain, without the spinal cord, without the neurology, how do the organs know what to do? So that tissue is so important, and God thought so too. How do I know that? Because we have a helmet, we have armor, we have protection, right? We have the equivalent of a phone case protecting our phone. Look at this. The skull and the spine is there in the womb protecting that neurologic tissue. It's that important. It's literally armor for a warrior here. Before they go out to battle, what are they going to do? They're going to protect themselves, right, as much as they possibly can. Now, the cool part about this, right, which you see in this image here, is we've got lots of armor, strong, immobile pieces here, like the helmet, right? But we also have that chainmail over his face. Why? Because we need to have this balance of protection and mobility. Our body is the exact same way. Our bones completely surround and protect the neurology, right? But they also have to move. We have to be able to bend and twist and run and be athletic and pick up our kids, right? So we have such a cool balance between protection, just like this, and flexibility and mobility, right? So when we look at these x-rays really tell us a story of what's happening with somebody. For example, how long these issues have been there. So, to not spend too much time on this, let's look at this and just kind of see what the story says here, okay? When we look at this x-ray on the right, there's some great things going on, and there's not so great things going on, right? And what this x-ray is going to tell us is it good or is it bad? And how bad is it? How long has it been there for? What's driving these issues, right? So we see the problem at one spot, but what's happening at the joint above? What's happening at the joint below? Is this something that we can ideally, or I shouldn't say ideally, is this something that we're hoping to just prevent from getting worse? Or is this something we can actually reverse, right? All of those things are possible in different situations with people. And because we took the x-ray, because we made the invisible visible now we can answer all of these questions and understand why you're dealing with the symptoms that you are. So yes, structure tells us all of these things. It tells us the story of your life, right? The good, the bad, the ugly, the whole biography of your life is literally in this x-ray. But structure also dictates function, right? When we look at those x-rays, when we look at the MRI, when we look at the imaging, because the spine is armor and it protects the neurology on the inside, it's also going to impact the neurology on the inside and therefore whatever it's connected to. So if we're looking at a low back x-ray here and we see this 13-degree scoliosis, we're looking at nerves on one side of the spine being compressed and one side being stretched. Well, where do those nerves go? Maybe they go to the legs, maybe they go to the butt, maybe they go down to the feet, right? But where else do they go? Do they go to the pelvic floor and the bladder, the prostate, reproductive organs? Do they go to the colon and the digestive system? Do they go to the kidneys and the adrenals? That's what's so cool about this, right? And is the pressure there also playing a role in those organs and their function, their ability to regenerate, their ability to heal? Are we having symptoms in those organs? Are we asymptomatic? Again, can we prevent, or are we hoping to reverse this? And are there other complicating factors in this, like food, like sleep, that are making things worse? Are you lifting heavy and it's compressing this 13-degree scoliosis a bit worse? Are you crossing your legs in a way that's helping this or hurting this? Are you leaning over to your partner in bed that's helping or hurting this, right? So making the invisible visible tells us so much about not just where your symptoms are coming from, right? But what we're going to do about it and the rest of your health. Okay, so hopefully you guys can tell this is so much fun. This is, seeing all this stuff gives us clarity and it sets us free. We don't have to be bound by the symptoms anymore. We can have amazing health. So let's jump into x-rays of the low back. Here we go. I'm going to go back to this bridge. I don't know why. I just love this bridge. I think it's so stinking cool. So we're going to look at this bridge from two angles. When we look at it from this view, we can see, yes, there's a little bit of a curve, but what we're looking at, the bridge is straight. There's no curves on this bridge as far as what people are driving on. It's straight across the bay, right? But there's also this suspension aspect to it, this big curved aspect to it. And why did the engineers do this? Well, over the bay, yes, there's a big span of distance that the bridge has to be strong enough to span across. And obviously there's also a load, lots of traffic that passes over this bridge every day. So there has to be this balance of strength going over this pass, but also the weather that comes through here is it's pretty crazy. High winds, lots of fog. The bridge also has to be flexible enough to withstand changing wind and changing weather. So this balance of strength and flexibility goes back to the armor of what we talked about. We must have a balance of the two. So when we look at the spine, and we're going to look at it structurally, just like we're structurally looking at this bridge, right? So here's an x-ray of the low back. We've got two of them. We've got one on the left, one on the right. When we're looking at somebody straight on, we want to see a spine that's straight like the one on the right side here. That's what we're looking for, a straight spine. And that straightness gives us the strength, right? Now, the x-ray on the left, obviously, we see an 11-degree scoliosis and some curves down below and some hips that are very unleveled. We see a structure that's taken some damage, a structure that's adapted to perhaps some physical trauma in its life, right? Maybe even some emotional trauma. There's some links there between the low back holding on to stress and holding on to unresolved emotions or even anger, repressed emotions, Coach Kaysen likes to talk about here, right? There's an emotional component to this too. But what we're looking at here is a healthy spine and an unhealthy spine. Let's look at the spine from the side. Same thing contrasting here. A healthy spine on the right, when we're looking at somebody's low back from the side, we should see a gentle curve. On the right side, we see that. On the left side, we see a spine that's very stiff, very rigid. We see something that isn't very cohesive in a smooth curve. We see some spaces that between the bones that have discs and some spaces that are pretty much bone on bone. A normal spine on the right has this curve for flexibility so that we can bend and twist and move. And on the left side there, a spine that's taken some physical trauma where we've lost the disc, and we're going to call it arthritis, right? I would like to know why it's there. I would love to know that story. Yes, there's some discs there that are gone, but we have some discs that are present. What do we got to do to make sure that the ones that are there don't leave and don't degenerate and don't thin out to be bone on bone like the couple towards the bottom? These are questions that we want answers to, and we can come up with a plan so that we can hopefully prevent the person on the left from this ever turning into a bigger issue, right? Here's some more examples, right? Here's some ones that have too much curve. Okay, so we're going to start all the way on the left-hand side. You can see an arrow down towards the bottom. There's some bones in here that are nice and big and tall and square, and that have a disc that are nice and tall. I'm looking at the bones on the farthest left x-ray up towards the top. That looks super healthy. And even though these bones are the same age, they're the same genes, when I look all the way down to the bottom, there's a bone that's a little bit wedge-shaped. On the back of that bone where the yellow line is, that vertical yellow line, the bone on the back side there is shorter than the bone on the front where that red arrow is. And the disc space down at the bottom is not as big as what it should be or what the other ones are higher up. Now, if we move to the second one over, same thing. You can see some bone spurs on the front of those bones. You can see some disc space that are quite a bit smaller in the bottom two segments versus the ones up there. What's the story there? Why did that happen? What can we do to make sure that that doesn't get worse? Can we prevent it? Is this just a structural thing, or is there a nutritional component to the disc height and the decaying bone? The third x-ray over, you can see another red arrow down towards the bottom, and you can see an example of that wedging a bit more aggressive on this one. A bone that's taller in the front and smaller in the back. Why is that happening? Towards the top there, right, a couple yellow arrows up towards the top, you can see a bone that's very scooped out in the front, right? A bone that's a bit more rectangular. Again, we've got a bone spur up towards the top of that bone. And the farthest x-ray over to the left, the image is clean and is clear, but that red arrow is pointing to another bone spur in the front. Hopefully you guys can see this and you guys can follow it, but what's the story with all this stuff? Do we just want to settle and allow this continue to get worse and accept the pain, accept the symptoms, accept the lack of function here, the lack of movement, the lack of health and vitality? Or is there something we can do to restore that? These are the questions that we ask in the office. Here's some x-rays looking at somebody straight on. Right? We see a red arrow on the farthest one over, another bone spur just from a different view here. Why is that happening? Why is it worse on the right side of that x-ray than the left side? The spine's leaning over to that side. Is the body making that bone spur for a reason? Is the body trying to protect itself from getting worse and that spine continuing to fall over? If you were going to fall over, wouldn't you want to put your hand down before you fell and hit the ground? Wouldn't you want to try to brace yourself for impact? Is the body doing that? On the middle x-ray, we see another bit of a curve, a bit of an S here as the body corrects itself, right? We see some discs that are not necessarily parallel in height like an Oreo cookie, right? The stuffing in an Oreo cookie, it should be pretty much parallel. It's the disc should be the same way here. We see one that's where that red arrow is, a side of the disc that's a bit higher in between the bones and the other side a bit less. We're at a greater risk for a disc herniation. Where that red arrow is, we see the bone again, it's starting to wedge. It's smaller on the inside of that curve versus the outside. Why is that happening? Guys, lots of questions here. Lots of questions here. And then we see an MRI on the right side. Towards the top of that MRI, we see some bones that aren't quite as damaged. They're a bit taller. They're a bit more squared off than the ones towards the bottom of this. We see some discs up at the top that are pretty healthy. They've got some white color, some hydration in them. And then we see some discs that are pretty blown out. Some discs that have gone beyond the platform of the bone that are herniating and bulging, right? You can see somebody there that's in a lot of pain, that's struggling, that probably doesn't have great function. And right next to the spine on that MRI image on the right, we see 2 kidneys right next to the spine, right? And again, when we talk about the neurology going through the spine that's branching out to those organs, are those kidneys being impacted because of the proximity to an issue here in the spine and the nerve system? When we see changes in the bone, this is what I think of, right? I think of a soda can. If I put enough pressure on that Coca-Cola can on the far left, if I put enough pressure, it slowly starts to buckle and lose its shape, right? And you can see that here. Now, how it buckles and the way that pattern buckles is going to be dependent on the angle and the direction of the force. That makes sense. When we look at bones in the body, and the way that bone is crumpling tells us a story of what's happening and why it's happening. But should we see that in the body? Is arthritis normal as we age? Ooh, I'm going to go back to the cancer thing. I'm going to go back to the heart disease thing. I'm going to go back to the diabetes thing, the statistics of autism all the way back in the beginning. Is it normal? I don't know. I don't think it is. I think it's really common. But we've seen plenty of x-rays over the years of people that are 60s, 70s, 80s that have no arthritis. We've seen plenty of people in their 30s. I've seen even arthritis as young as people in 16 years old. Is it normal? This is the way that I like to look at it. It's when somebody dies, right? And they're buried or whatever, right? Or an animal dies like this example here. What's the last thing that's left over of them? Well, it's their bones. The bony structure is the strongest tissue that we have in the body, right? Why is there arthritis and degeneration, right? Why are these bones crumpling like a soda can, right, when somebody's alive? Why are those things happening when this is the tissue that's left over? Isn't that a great question to ask? I wonder what AI would say about this. What I like to say is, even though we're going towards our artificial intelligence, there's an intelligence in your body, and it's always striving for our best. Why would our body, right? Why would these bones crumple and decay and degenerate in the body? Well, if you want to look this up, it's pretty fascinating. Wolff's Law. You know, gravity is only a theory. Gravity is not a law. But Wolff's Law is. This happens every time, not some of the time. I don't ever have to guess about that, right? In an area of instability, the body will try to stabilize the area, right? In an area of trauma, right, that sparks inflammation, the body's going to try to stabilize it. How does it do that? After the trauma, after the insult, after the injury, after the inflammation, what the body will do next is start to form some scar tissue, right? If that inflammation doesn't go away, it goes down this cascade towards scar tissue. Why? Well, scar tissue is fibrotic, right? It can hold on to these things. It can try to stabilize the area. And if that scar tissue continues to spread and grow and it doesn't get reversed, we don't restore normal function, right? Well, then we move towards arthritis, right? Arthritis of the disc. The disc starts to get smaller, as you can see on this x-ray, right? Right where that red arrow is. You can see the height between the two bones is much smaller, right? Why is it trying to do that? The body is stabilizing, right? Yes, that we're losing some motion, we're losing some flexibility, but the body's trying to stabilize that joint. We're going to increase the platform size, right? You can see how those bones where the red arrows are a little bit longer, more rectangular shape than the bones up top that are taller and square, right? We're going to try to form these little spurs, again, right where that red arrow is. You can see these bone spurs. The shape of those bones used to look tall and square like the ones up top, but now these things are adapting, right? Because the body's trying to stabilize the area after the injury, after the insult. So we'll call that arthritis, right? Or degeneration of that joint, of that bone, of that disc. And again, what's the story here? Why is that happening? And what can we do to make sure that this doesn't get worse and turn into a bigger issue for people? So we're talking about structure, right? But again, because the bones surround and protect the neurology, it's so important. And I would say more important, way more important to understand that the structure of the spine is going to dictate the health of the neurology and what that neurology is connected to inside the spine. Let's look at some MRIs here. We're going to look at the low back from the side, right? And again, what do we want to see? We want to see a small curve in the low back. You can see on that far left x-ray, we've got a disc popping back into the spinal cord. The spinal cord is the vertical tissue there right behind the bones, right behind the bone and the disc, right? You can also see how those discs, some of them are big and tall and white and hydrated. They're flexible, they're pliable. The disc that's herniated, where that red arrow is on the left side, it's darker in color. It's more brittle. It's not as hydrated. It's not as flexible, right? And it's herniated, and it's putting direct pressure on that spinal cord in the back. Now, the middle image, you can see the same thing, right? It's a different segment. It's up a little bit higher. So that person is probably going to experience symptoms of that herniation in different areas in their body. And then we've got one at multiple levels on the MRI on the far right. These are all different examples. And the one on the far right, you can see a little bit more changes in the bone, right? Change in the shape. We've got some really healthy ones towards the top on all of these. And we've got some ones that aren't so good. Why? Why is that happening, right? Why are some great and some aren't? Some healthy and some are sick. This idea here of spinal destructure is so cool. So when the bones are healthy, when the discs are healthy, when things are well, we've got a healthy nerve. But when we start to have this destructure, this scar tissue, this inflammation, this degeneration, this arthritis that I've been showing you, right? By default, it starts to put pressure and tension on the neurology inside, sometimes on the nerves that go to the right, sometimes on the nerves that go to the left, sometimes even on the spinal cord, right? But what we start to do with that stretch, the neurology starts to get stretched. It starts to get compressed. It's compromised. And when that's done in a minimal way, we'll call it neuralgia, pain of the neurology. That whisper, remember we talked about if you listen to your body and when it whispers, you never have to hear it scream. If we're not paying attention to that whisper, right? When we're not paying attention to the structure side of things and we're just trying to quiet down the pain, eventually, when that destructure is still there, the next thing it's going to turn into is neuritis, inflammation of that neurology, and potentially even damage, right, to the neurology. And last one we're going to say is neuropathy, right? It's when there's even more than just pain. We're losing function, right? Say, for example, like drop foot, right? Or varicose veins or spider veins in the legs, right? Lack of blood flow, because again, what controls blood flow is the neurology. What controls those capillaries to open and close? It's all about the neurology, isn't it? So if we're not correcting this destructure, we're going to get further degeneration of the neurology then, right? And potentially even death of that neurology. So interesting. Perfect example, right? As if we're watering a garden and we start to decrease the flow, there's less water coming out. If we kink the hose and we don't have water at the end of the hose, the problem isn't at the end of the hose, it's where that kink is. Does that make sense? So to me, less water, less life, right? Less neurology, less life. Less neurology, more stress at the neurology, less vitality, less repair, less regeneration at whatever tissue's connected to that nerve at the end of it. Whether it's the blood vessels, like we said, the muscle, the joint, the kidneys, the adrenals, whatever it's going to, there's less function at the end of it. Okay? So when this destructure happens in the lumbar, right, when we're talking about the neurology, well, again, if it goes to the digestive system, we can have symptoms like constipation, bloating, gas, irritable bowel syndrome, Crohn's disease, ulcerative colitis, food sensitivities. In the reproductive system, if the neurology is impacted, that goes to the prostate, we're going to have prostate issues. Maybe it's a flow issue. Maybe it's a prostate cancer. For real, how many men do you know, or if you're a man listening to this, how many other male friends do you know that have low back pain? It's so interesting because what's the two most common types of cancer for men? Prostate cancer and colon cancer. Is there a link there? I think so. When we talk about this, I don't think, of course, this is how it works. It's not a guess. This is how our body works. You know, you can't negotiate with Mother Nature. This is how it works. For women, if there's issues in the low back, it can lead to infertility or miscarriages. It can lead to pelvic floor issues, bladder issues. If the neurology goes to the liver, so many people have liver issues these days. Plenty of examples there. If it's, pain, we're so focused on pain, but there's plenty of examples there. When there's lumbar, again, none of these things that I've listed here are problems, right? They're all symptoms. Every one of those things there are symptoms. What's driving those symptoms? If there's lumbar dysstructure, we have to address that. Let's move on to the cervical curve. We had the analogy of the bridge. Let's talk about a banana. A banana from one angle is straight. A banana from the other angle has a curve, right? If we try to add more curve to that banana, if we try to straighten out that banana, take the curve out of it, eventually that peel that protects the fruit would damage the fruit. Well, it's the same thing in the spine, right? When we look at a curve in the neck, here's two difficult ones to see, right? A scoliosis of 12 degrees in the bottom one here, and something that's even worse on the right side here, a massive, compacted scoliosis. And if we wouldn't have taken x-rays, we wouldn't have seen these things. It makes it so clear to see. But again, if a banana is supposed to be straight, if a spine's supposed to be straight here, and we have these curves, it's going to impact the fruit on the inside, the spinal cord on the inside. We just have to understand where those branches go to, what it's connected to, and how bad it is. When we look at the banana from the side, we want to see a curve like the one on the right side. The one on the left side, we have cervical dysstructure, right? We've lost that curve. And on this person, not only have we straightened that curve on the left side, but the curve is starting to go the opposite way. We've got a negative 3-degree curve here when the ideal curve is 45 degrees. Now, this is a patient that came into our office and got actually correction in the office. This is a before and after of Matthew. Matthew was dealing with a bunch of stuff, allergies, headaches, some ADD, some behavioral stuff, some aggression that he was dealing with. It's so crazy. We didn't really do anything for food here with Matthew. We didn't do anything for sleep with Matthew. We saw this in his neck on the x-ray. We saw what we had to do, and that was where we started. Because the neurology controls everything else, Matthew saw tons of changes beyond just the headaches and the symptoms that he was dealing with here that went beyond his main complaint when he came in. But Matthew was young. Matthew was in high school, so his neck was flexible, was pliable. The arthritis hadn't set in, right? His body was able to adapt to the changes that we put into it and develop a new normal, just like braces on the teeth. Here's some people that are a bit older, much past high school. Their problems have been there for a long time. You can see on the left side, towards the top of the spine there, a healthy bone to some extent, a healthy big disc, and then you can see massive bone spurs and a fusion here. You can see the change in shape of those bones are massive. Now, when the bones have fused like this, and we see one on the right side too, a huge bone spur that has formed a fusion between the 5 and 6 vertebrae on that right side, right? We see a fusion. We can't change the shape of those bones. That problem has been there so long. It's so dramatic. We can't change the shape of that, right? But the ones above, how do we prevent the ones that are healthy, right, from turning into the ones below? Because those joints are fused now and they don't move the way a normal joint moves. It doesn't bend and twist like it does. The ones above it have to make up for that loss of motion. So they're bending and twisting more, which means there's more wear and tear, which means they're going to wear out faster, which means that degeneration is going to become contagious. It's going to move above those areas of fusion. It's going to move below those areas of fusion. How can we minimize that contagious spread? How can we optimize the structure here, not just for the bones and the disc, but for the neurology underneath it? Watch this. We're going to show you a time lapse here, right, of a healthy spine with a curve, the shape of the bones, the discs. And as we lose that curve, watch what happens to the shape of the bones. Watch what happens to the discs. Starting to change now, right in the middle, right, especially where that curve is going the wrong way. Those bones continue to morph over time. They change shape. They get wider. They get closer. Look at the one up top, though. It's still healthy. It's still there. It's still there. Oh, look at that. Look at how bad that gets. Look at all that lipping down at the bottom. Look at the spurs down at the bottom. Isn't that wild? Over time, what an incredible time lapse. Thank you to CBP. There's a technique in chiropractic called chiropractic biophysics. Shout out to all you docs. You guys are amazing. So stinking cool. Their focus is not helping people feel better. It's helping change the structure. There's very few of us that focus on that within the chiropractic world. Let's go back and just watch that one more time. Watch how this changes shape over time. This person's flexibility, their range of motion is completely changed over time, right? But I also want you to think of that spinal cord inside. I also want you to think of that neurology, where those nerves branch off in the middle of the neck to the thyroid, right? As those nerves branch out down a little bit lower in the neck, down towards the arms and the hands, the heart, the lungs, the breast tissue. How else is this person's health being impacted because of this? This is so much more than a bone problem. This is so much more than a disc problem. Because they've lost that structure in their neck, this is now a neurology problem. This is now a health crisis in their body. Because structure dictates function. Because that neurology is armor for the bones, the spine is armor for the neurology inside, right? When we have a spine problem, we have a neurology problem. In the chiropractic world, we call this the arc of life, this curve in the neck, the arc of life. Hey, you guys, I'm going to take a break here. I've got some patients coming in the next couple minutes, so I'm going to pause here and I'm coming back, okay? Thanks for hanging with me. This is awesome. We've got plenty more to talk about. So I will be back with a different shirt and we'll keep going. Thanks for joining me, you guys. Hey guys, I am back as promised. Thanks for sticking with me here. We're going to keep just rocking through this. We left off talking about this arc of life. This is what we call it in the chiropractic world, the arc of life. I think that's a pretty fitting thing. And I think it's important to know how posture, how the curve of this neck, how this structure doesn't just relate to the neurology, but of course what that neurology connects to, which is the rest of the body. This is a great way to say that the posture of the nerve system really equals to like the quality of life, the function of life. Like, look at this young athlete. You think about his posture, and you look at this older gentleman who's lost his posture. His ability, his vitality of life, his ability to move, right? His ability to breathe. How good is his heart beating when his chest is over the top of it and compressing his lungs, his heart? It's just interesting to make those kind of connections, right? I think as we age, you see people who can move, the people who are healthy, people who are active. Those are the ones that maintain a really good posture, a really good curve in their neck, a really good structure. Let's keep going. Let's keep talking about this arc of life here. We've got an X-ray on the right-hand side. This is Tony. We see some of the things that we've already talked about, right? We've lost some of the space between the bones. We've lost the shape of the bones on that right side. How is that impacting the neurology? Well, let's look at the MRI on the left-hand side. We see the bones, we see the disc, and then we see the spinal cord coming through. And we see those bones and the discs are literally spurring, putting pressure. They're encroaching upon the health of that spinal cord, right? We see a direct neurological implications from the structure of the spine, right? Tony is doing pretty good, but he's also has a lot of issues because of what's happening here. Let's look at some more MRIs. On the left-hand side, we see, again, another loss of that cervical curve. And about halfway through there, we see a disc intruding upon the spinal cord, right? Middle one, we don't see it quite as aggressive. We see it happening up a little bit higher. But again, you can see the shape of the bones, the shape of the disc. There's a lot of stuff going on in the spine. And then again, you see the direct neurologic implications. And a couple more examples on the far right-hand side. It's so important to know that when we have a structure issue, we have a neurologic issue. It just depends on how bad it is. And these images just really show us that. It's so stinking cool. It just makes the invisible visible. We know exactly what's going on. I'm going to use an analogy here when we see those neurological implications. We already talked about a banana from a couple different angles. I think it's cool to think about a banana sliced here and its mirror imaging of a spinal cord, a slice of a spinal cord, right? This always leads me deeper and deeper, so we're going to continue to do that in this video. I want you to think about the peel of this banana, right? When we already talked about how a banana has a curve. When we take that curve out, the peel that protects the fruit can damage the fruit. Why don't we kind of envision between the peel of the banana and the fruit of the banana to have a layer of fluid? Okay, I'm going to equate this to cerebrospinal fluid in the spine, right, in the neurologic system. There is a layer of fluid between the spinal cord and the outer layer there. It literally bathes, this fluid bathes the neurologic tissue because it's rich in nutrition, right? And what it does when our spine moves, it moves the fluid. And that fluid brings nutrition, not just over the spinal cord, as we're talking about kind of in the banana analogy, right? But that fluid brings nutrition up to the brain. And having the proper structure, the proper curve, guarantees that that fluid is moving, right? That there's no hitches in it. But when we go back to that MRI, right, and we see how this impingement into the neurologic tissue is impacting the nerves, it's also going to impact the flow of that fluid. And if we think about the moat, we'll call it a moat maybe, right? Or like a protective barrier, that fluid completely around the outside of that spinal cord. When we're moving the spine, it's bringing nutrition up. If we have a herniated disc, we lose the structure, cervical destructure, it limits how much nutrition goes up to the brain, how much fluid and nutrition goes up to the brain. And could we have a possible deficiency of that fluid if there's a loss, a cervical disc structure? I think it's very likely that that could happen. I think it's very likely indeed that that could happen, right? When we look at this picture here and we look at the bananas, how we almost have these black kind of seeds or the kind of the core, whatever you want to say of the banana. I don't know the scientific term, but we also have something similar in the spinal cord. If you look right at the center of the spinal cord, there's a little hole. That's actually the drainage of the cerebral spinal fluid. So as it circulates from the spine, let's go back to this image, as it circulates up through movement of the spine and it brings nutrition up to the brain, as it meanders through the brain and the flow of the brain through the aqueducts of the brain, as the brain uses that nutrition in the spinal fluid, right, it has to drain out, and it drains out through the center of the banana, through the center of that spinal cord. And again, if there's a cervical disc structure, does that limit how much waste products after the brain has used it leaves the brain? Right? Kind of like as we put gas into a car and there's exhaust from the engine of what it uses, right? That exhaust has to flow out of the car to get rid of the waste. The brain is the exact same way. It's just like an engine. That waste has to leave. Again, if we hinder the flow of that waste product, could it be possible that we'd have a toxicity over time of waste products building up in the brain? You know, I think that those are great questions to ask. I don't know exactly how to prove that from happening. I just think it's an excellent question that lead to these kind of things, right? If that cerebral spinal fluid is limited on the way up, does it create symptoms from that deficiency of the nutrition? As we have a lack of flow of the waste products leaving the brain, could it be possible that we have a toxicity that could lead to some of these symptoms? It's so interesting. I just want to continue to remind you that we cannot disconnect the health of the spine to the health of the neurology. And one of my mentors, shout out to Dr. Dan Sullivan, always says this, that an unhealthy spine means that we have an unhealthy brain. Now, we've talked quite a bit about stress today. We've talked kind of on the chemical side of things with medications and how medications do a great job of covering up the symptoms, but do nothing to address the root cause of the problem. And we've talked a lot about the physical side of things, going through these x-rays, going through the MRIs. But what about the mental part? I want to make sure that I'm tying in the mental emotional part to the cervical disc structure. And the way that we do that is through the vagus nerve. Not this vagus nerve, but the vagus nerve. So let's go through this a bit in detail as we continue to do in this video. So bear with me. No pun intended on that slide. So if we've got a bear jumping out of the woods, we have a reaction system in our body that signals danger to keep us alive, right? And it's called fight or flight. We're going to liken that as an analogy today to a gas pedal and a brake pedal, right? Fight or flight. So when a bear jumps out of the woods, this is a good thing that we jump into survival mode. We've got a couple options here. We're going to get away. We're going to hide, or we're going to put up a fight, right? And so when that happens, if we're preparing for the fight or the flight, our body prioritizes certain things in the body for survival. It prioritizes blood to the heart and blood to the lungs and blood to the muscles so that we've got enough blood pumping and enough air in our body so that we can, again, put up a fight or run the heck away. Now, in an ideal situation, once we're out of danger, either we've killed the bear or we're hiding and we're out of the way and the bear is gone, then our body goes through this process of going back to homeostasis, going back to balance, going back to the other functions that are important for thriving now that we're out of survival mode, right? We've caught our breath, our digestion comes back, we're trying to repair from whatever happened in that fight. We're going to socially and emotionally connect with our loved ones and our family, our tribe, whatever word that you want to say, right? And stress has stopped. We've got calm waters again. Now, the hard part is if another bear comes around the corner, or a mountain lion, or we've run so far away from camp that we've got to build another structure, or we've got to get food, right? If stress continues, it's very hard for our body to find balance again, right? Our defenses stay up, and we don't get into that resting, that digesting, the healing state. We're not repairing from the wounds that we may have gotten, right? Our body isn't going to get quality sleep if danger continues, right? So instead of calm waters, we continue to have this storm, if you will, these rough, turbulent waters. And over time, because stress is continuing, we end up building, right? If we're talking about that gas pedal and that brake pedal, we end up building the engine of a Ferrari, right? Our body is just a highly tuned machine to just destroy danger, right? And maybe in our modern world, this is less a bear, but maybe this is, the to-do list that you have in front of you. Maybe it's the to-do list for work. Maybe it's the to-do list for at home, right? Maybe it's a to-do list for all the, your kids and your family, right? But we build the engine of a Ferrari to just crush the stress that's in front of us, right? But we don't have the brakes to match that Ferrari. We end up having the brakes of a tricycle, right? A completely mismatched kind of system here. Anybody who's, into high performance cars knows that the engine is super important, but you got to slow that down to go around the corner. There's a balance there, and it's the same thing in our body. And when we build the engine of Ferrari and we have the brakes of a tricycle, we're going to call that either sympathetic dominance, right? The dominance of fight or flight, or parasympathetic, the rest, digest, and heal, parasympathetic insufficiency. We're going to go back to this awesome quote by Dr. Bruce Lipton. He says that your cells cannot be in growth and protection at the same time. You can't be running away from the bear and, falling asleep at the same time, right? It's a teeter-totter. We're either in one or the other, and it's not a versus, right? There's an appropriate time to be running away from the bear, and there's an appropriate time to be healing from the fight that you had from the bear, right? And so when our body's on the gas pedal, because it doesn't care about, or because it's prioritizing, we talked about the heart, the lungs, the muscle, all of these other things go by the wayside. Here's some examples, many, many examples. So for you, if you feel like you're stuck fighting the bear, if you feel like you're stuck in fight or flight, these are the things that we can expect to happen and expect to see, right? Maybe it's some of these, maybe it's one of these, maybe it's all of these for you. Digestive issues, and there's a whole slew of things. It doesn't matter what you call it, but digestive issues, right? Brain fog, exhaustion, you're wired. You're absolutely wired, but you're tired, right? You're exhausted and you're trying to fall asleep, but you can't shut your brain off. That's your body still on the gas pedal, right? Even though you're sitting at the brake, or you're sitting at the stoplight, right? Your foot's on the brake, you know that you should be going to sleep, but your other foot's still on that gas pedal, ready to wage war, right? If you're anxious, if you're struggling with weight loss resistance, if your heart's beating out of your chest, you're just so easily triggered by even the smallest things, this means that your body's out of balance and it's stuck in fight or flight. Hopefully this is resonating with you. This is the emotional side here of stress. How about the flip side? When we're in that brake system, right? When we're away from the bear, when our body's digesting the stress, if you will, here's the things that turn off and the things that turn on, right? Our heart, our lungs, and our muscle, that's not the priority anymore. Now our body is trying to build the immune system. It's trying to digest, absorb the meal that you took in, and then turn that into heart cells, right? Or turn that into new lung cells or new muscle, or again, heal the wounds maybe from the fight. Our body is prioritizing sleep. It's prioritizing reproduction and building a family. We're trying to emotionally and socially connect with our tribe, our family, our loved ones. This is what it looks like. This is the life of our dreams that we're all after, right? When we're on that brake pedal, these are the things that happen. Instead of brain fog, we have mental clarity. Instead of digestive issues, we have amazing digestive system, right? We're having a bowel movement in that 3 to 4 range on the Bristol stool chart, like Coach Kaysen loves, right? We're having great bowel movements two times a day, right? Instead of a heart that is racing, right, and palpating out of our chest, we have a normal resting heart rate. We're happy, we're patient, we're not easily triggered, right? We're deep sleep, right? The difference is massive if our body's in the gas pedal versus when our body's on the brake pedal. Now, I think that makes sense to everybody. Now, here's the kicker. What if you're being tricked? I was trying to figure out exactly how to word this, but I think we nailed it here. What if your body always thinks it's in danger? What if your body's falsely perceiving its environment, not just from the stress of life, right? We talked about work and family and relationships and finances. There's so many different avenues of stress for people, but what if your body always thinks it's in stress? Is that possible? This is so stinking cool. When we've already talked about posture, right? When we have that normal cervical curve, that arc of life, we know that there's no stress, there's no tension, there's no issues on the spinal cord and on the brainstem. But look at how this neck progresses forward, right? When we lose that curve, right? We've talked about what happens with that cervical structure. Well, there's something deeper that happens here. The loss, this is from Dr. Alfred Brigg, a medical doctor, from thousands of autopsies. He noted that the loss of the cervical curve actually stretches the spinal cord around 5 to 7 centimeters, depending, I assume, on the height of the person and the intensity of that loss of the cervical curve. And what it does is it pulls the brainstem into the spinal canal and it puts the body into a state of disease. Well, Alfred Brigg didn't say this, a couple weeks ago or a couple years ago. This was a while back. This is a while back where he was publicly saying this. And we're going to show you some new research that actually proves what he was saying and its impact on the vagus nerve, right? So in 2005, the Spine Journal came out, a prestigious medical journal. It said when we lose our cervical curve, when our head falls forward, it impacts all measures of health, right? Again, we talked about heart rate, we talked about digestion, we talked about our mood, we talked about brain fog, all these different measurements of health. Spine Journal found that when our head falls forward, all measures of health decreased. And it was a decent sized study, just under 800 people, right? But again, in the medical side of things, when we lose that curve and we fall forward, their solution in this was surgery, unfortunately, right? Now, ideally, if we could prevent losing the curve, that would be great. If we could fix it naturally once we lose it, that would be great. Surgery is maybe a last case scenario, and when we absolutely need it, thank God that there's an option for it, right? But check this out. If you want to geek out further than what we've geeked out today, Caring Medical out of Southwest Florida, so cool that they're here in just north of our location here in Naples. I think these guys have the best information on planet Earth. What he is proving is that when we lose the cervical curve, and again, that brainstem, there's pressure on it, like Dr. Alfred Brigg talks about, that 5 to 7 centimeters of stretch, that tension in the spinal cord, it puts a physical pressure on the vagus nerve. And what it does is it mimics this emotional fight or flight state. Because there's pressure on that nerve, your body is constantly in fight or flight. And the only way to change that is to restore the cervical structure. It's so incredible, the research that those guys are doing, the studies that they're putting forth, and how it's actually changing people's lives, right? That vagus nerve is kind of like the brakes to our system. It's the neurologic brake to the gas pedal. But when there's pressure on it, which we're going to talk about here in a second, how that works, when there's pressure on it, it impacts it being able to find balance. It overstimulates it and it becomes hypersensitive, and there's all this neurologic cascade, again, we're going to talk about in a second. But I think sometimes it's hard to understand why, when there's pressure on this nerve or that nerve or the vagus nerve, how it can, why symptoms show up. So let's kind of go through that. So here's a macroscopic image of a nerve bundle, right? Or maybe I should just say a nerve. It's bundled with a bunch of other nerves, right? And you can see there's some blood flow right in the middle of that, little capillaries to feed that and to help these nerves regenerate and heal. It's amazing how we are made. So I think it's important to note, when we look at that MRI and that disc was kind of pushing back into the cervical, the spinal cord. This is not an image of the spinal cord. This is a nerve, right? And if that disc pushes into that top red circle that I've got on here, well, depending on where those nerves go to, we could see symptoms on those nerves. And if there was on the other red circle that I have on the left image here, in the lower corner of my screen, if the disc kind of pushes in on that side, then maybe those nerves go to a different part, right? So it depends on where the nerve is being damaged or stressed, or where the majority of the tension is, that it's going to dictate where the symptoms show up. So I pulled this off of Caring Medical, and specifically from their website. This is specifically talking about the branches of the vagus nerve. And again, depending on where the pressure is, there's an auricular branch, right? So the part of that vagus nerve goes out to the ear canal, right? And so if we have tinnitus, if we have if we have sensitivities in the ear canal, if we have overstimulation there, we can go back to the vagus nerve. Stop looking at the ear. Let's go back to the vagus nerve and see what that looks like. The pharyngeal branch, we could have symptoms of poor swallowing, right? An easy gag reflex, right? This goes back to the eustachian tube, the drainage for the ear into the back of the throat. The laryngeal branch, the cardiac branch, the bronchial branch. I don't need to read this for you guys. You can read it. But there's all these branches of the vagus nerve that when we have gastroparesis or poor digestion or dysmotility, a slowness, constipation all the way through the digestive tract, if you will, leaky gut, we're spending so much time trying to treat the symptoms in the gut instead of going back to the vagus nerve. Why is that happening? This just unlocks a completely different level of care when we look at it through this lens, right? And what's your doctor doing, right? When we go and look at the ear, right? We go look at the end symptoms. The doctor says, hey, I don't see anything in the ear. Your ear is normal. What if the doctor says, yeah, I understand that you've got poor swallow, you're not swallowing, you feel like something's there. Is he checking your vagus nerve or is he just giving you a clear test, right? He's saying you're fine, your symptoms, I'm not seeing anything there. Maybe they're subclinical, shortness of breath, right? But all the tests that we just did, the stress test checked out, right? Or we did a scope down your throat and we don't see anything at the top of your esophagus, you're clear. But doc, I still have acid reflux or I still have pressure there. I still feel like I'm, full at the top. Or vice versa, if they do a scope from the other end, your colonoscopy, it's all clear, but you're still having gastric issues. How frustrating is that? So many people are dealing with that kind of stuff. And either as the doctor gives an all clear, they're either going to do one of two things. They're going to say, go home and figure it out because there's all your tests came back clear. Or their other tool is, again, to try to quiet some of those symptoms with medication. Oh, and because we're not addressing the root cause, we're just waiting for these symptoms, waiting for the problem to get worse. It is so frustrating. I can't tell you how many people have come into this practice over 16 years and said exactly those words. Well, again, there's an explanation for it, a deeper explanation for it. So because we've talked about the vagus nerve, because we've talked about the emotional side of things, we're going to tie that into this kind of cascade here. These 4 Ds is what we're going to talk about. Dysregulation, dyskinesia, disafferentation, dysautonomia, and dyskinesis. So bear with me. We're going to continue to tie this stuff together. So dyskinesia is the definition here, is the abnormal alignment of the spine, which we've seen plenty of x-rays of that. We've seen plenty of MRIs now of that. And vertebral subluxation. So all that means is a bone that's slightly out of place. And what it does when that malalignment is there is it causes irritation and stress. Irritation of stress to what? Well, of the tendons, of the disc, of the bone, right? Of the muscle, of the blood flow, of the neurology, all the tissues, right? We want to separate those things, but it causes irritation and stress in that local region. Now, if we don't change that alignment, if we don't fix that bone that's out of place, right? If we don't change that dyskinesia, the abnormal movement of that segment, right? What does it lead to next? The thing that it leads to next is disafferentation. Right? So what does that mean? It means that there's an abnormal neural input into the brain. Because that bone is out of place, the neurologic messages that are going up to the brain are changed, right? And of course, we experience life through the nerve system, right? Our sight, our sound, our ears, right? Our taste, our touch, smell, balance, movement, everything, every triumph, every tragedy of life, we are experiencing that through the nerve system. And because we've got dyskinesia, right? That bone, that ear out of place, that abnormal movement of that segment, it's going to change how that brain takes the messages in. Now, it's of note is that our neurology, like we said, is a two-way highway. As that information comes in, the brain has got to figure out that message and make the best decision, the best response. So if that segment is more irritated, it's more inflamed, it's more triggered, that area becomes hypersensitive, right? Here's an example. Do you ever, I always thought this was so weird when I was a kid that like when we would get close, when we were driving in the car on like a family trip, right? That when we would get close to the destination, the last handful of turns, the last maybe 5 minutes of traveling, did your family ever turn down the music in the car? Was that just in our house? I find myself doing that now as I'm aging all the time. I love listening to a podcast or music in the car, but I notice that when I'm getting close and my stress levels go up the last little bit, I want to make sure I'm finding that parking spot or that last turn, right? I'm really focused, that I start to turn down all this background noise as my stress levels get up so that my brain can try to make the best decision possible when it really counts. Right? So let's go to this kind of computer jargon, this input output. As those messages come into the brain, your brain is always trying to make the best decision it can based off its perception of the environment. Now, what happens when its perception of the environment is off? We just talked about dyskinesia, right? And we just talked about disafferentation. We just talked about those two things. That input is changed into the brain. Now, what happens when that's off, right? This cascade continues. So we went from dyskinesia, we went to disafferentation. Now, if that doesn't change, if that doesn't get corrected, the thing that happens next is dysautonomia. It's a state of imbalance of that autonomic functions of the nerve system that creates our body being dominant, being stuck in fight or flight. And this happens the body prioritizes that over the rest, digest, and heal function. We talked about this already, right? But here's the cascade that happens. Our body literally gets stuck in stress. We're easily triggered. Our body cannot be in growth and protection at the same time. And if that doesn't get corrected, if this cascade continues, the last thing here is dyskinesis. It's a reversible physiological state consisting of unnoticed, misdirected neurophysical reactions to environmental stressors, emotions, thoughts, chemical toxins, and physical traumas. It's errors in energy output, mental organization, systems regulation, and it changes our body's ability to heal our emotional and social interactions. And it all started with that dyskinesia. That just the change in the structure leads to all of these things. Oh, it's just wild, this dysautonomia, this dysregulation. Now, my question to you is, if you're still listening to this far into the talk here, how far into this is your health, right? Are you just at the early stages, that dyskinesia? Are you a bit further? Are you all the way down into dyskinesis, right? Remember, it's all reversible. We just have to figure out where that dyskinesia is happening, right? Again, we lose that cervical structure. Here's all sorts of issues, right? It can change the mood and the brain. Maybe it's because of the pressure on the vagus nerve. Maybe it's because of the cerebrospinal fluid, right? But I mean, look at the examples. Headaches and pain and vertigo, tinnitus, and this is just such a short list. But we continue to treat these symptoms instead of going back to the root, right? These are not issues with your lungs, your thyroid. There's not issues with your ears. It's a nerve system dysregulation issue. Remember, an unhealthy spine means unhealthy neurology. Unhealthy neurology is caused by an unhealthy spine. Now, when all of those things happen, right, we're just always told to trust the science. It's scary as science continues to become, it feels like, maybe more and more of a religion, right? When there's a spine problem, what's the gold standard in this country, right? It's always this, wonderful people, but it's in this system, it's just a broken system, right? We don't go back to the root cause and look at that nerve system. We continue to treat the symptoms of its effects. So here's Sharon, X-ray years and years ago. Sharon sits at a computer for the majority of the day, is an accountant. You can see what her neck looks like on the far left, right? We got a couple segments up top that look beautiful and healthy, although there's some instability there. That C3 of hers wants to fall forward, right? And we have a major reversal of that cervical curve. Took that X-ray probably back in 2012, I think, 2012, right? The first maybe couple years we were open at our office. That was at that time the worst X-ray I had seen. Flash forward, present time, here's a cervical fusion that Sharon had to have. If there's a way that we can prevent this from happening, why are we not doing this for people in any way possible? Yes, I understand that there's a time and a place where we can't really help Sharon, right? There isn't a whole ton when bones are fused that chiropractic can do. But why didn't we know this about Sharon 20 years before this happened to her? Not the surgery, but the X-ray on the left. Man, I wish we could do something about it. Here's another surgical fusion in the low back. And I don't know the story here. This is not an X-ray that was taken in my office. This could have been from trauma, which it looks like there's a big screw going down into the SI joint, into the pelvis for stabilization. However, getting a trauma or an accident out of the way, when someone has chronic low back pain and their first touch is a surgeon, the studies show that on average, if their first touch is the medical field, an MD or primary care, 42% of those people end up going to surgery. When someone has chronic low back pain and their first touch is a chiropractor, on average, only 1.5% of those people end up having to go surgery. Why is there such a drastic difference, in those statistics when someone has chronic low back pain? Does this play a role in decisions sometimes? Because surgery is a very profitable thing. Is it that those practitioners don't have tools or don't understand chiropractic? I hope that changes at some point. And again, is chiropractic right for all people at all times? Absolutely not. But I don't think surgery is right for all people at all times. I would love to know what the truth of that number really should be. Is it closer to the 1.5% of people, that actually need surgery? Should it be 42? Should it be somewhere in between? I don't know what the answer is, right? But I love that 1.5%, right? Our system, according to Walter Cronkite, right? Our healthcare system is not healthy. It's not caring. Nor is it really a system. It is such a broken system. When we continue to dabble in the medical industrial complex, drugs and surgery are just the name of the game, right? And like, you can't have surgery, spinal surgery, right, and not have major consequences to pay, right? Taking care of your spine and your nerve system is not an optional thing. Whether you want to do it now or whether you want to do it later when you have less options, it's totally up to you. But I think everybody deserves to understand exactly what's going on in their spine, and that's why we've created the office that we have. If you want some further statistics with contrasting the medical field to chiropractic patients, on average, pay 31% less for their healthcare costs. They have chiropractic patients, 60%, they have 60% fewer hospital visits, and that's across the board, not just surgeries, but that's for immune stuff, that's for stomach stuff, that's for all the things, right? 62% less surgeries, and they spend 85% less on drugs. So forget all the science that we talked about. If saving money is important to you, then I would suggest looking into chiropractic. Okay, so we've geeked out, I think, as deep as what we're going to geek out. What's next? If you're still listening here, let's go through a couple things to help your body heal. What are the responsibilities of care at our office? Well, I always like to give, after I go through our responsibilities and the options that you have here, I'm going to give you some tools that you can have for your responsibilities when you're not at our office. So again, if you've looked to our office for help, if you've gotten x-rays, if you are trying to decide if it's something that we can help you with, obviously, when I sit down and talk with you, I will let you know if I can help you, right? And if I can, here's your three options. You can do nothing about it, right? You can wait until it turns into a bigger thing, and I always want to assure you that our door is open, right? You can treat your symptoms, or you can pursue a little bit deeper and try to change the reason why those symptoms are there in the first place. So my disclaimer is, if you do nothing, my promise to you is that my door is always open. Right? That's a phone call, that's an email, that's my physical location, whatever I can do to help you, whatever I can do to serve you, I promise to always be here to help you if now's not the right time for you. Now, option number 2 is if you're looking for symptom-based care, I just want to give you a couple disclaimers here. What that means is that we're just using chiropractic to help you feel better. And when you feel better and when you get to a better spot from your definition, right, that means that we kind of stop care. And you're going to be on your own. You're going to be doing things on your own. And if those symptoms ever come back, that my door is open, right? So let's look at just a little bit deeper of what that looks like. Okay, if we go for symptom-based care, we're going to start way in the bottom left-hand corner here, okay? This is where symptoms start. All these little dots on this big kind of graph here are going to be your visits into the office. And when we're in the red, when our symptoms are really, really bad, right, we're going to unfortunately probably have to see people more often to get them through these symptoms, to get them feeling better. And as you can see, as we get up into the yellow, we typically see people less and less, and hopefully we get them to a great spot where we have to see them as little as possible to maintain, right? The feeling better, moving better, right? The symptoms are gone, right? It should take less and less. Now, on the bottom part here, if we stop care, once we start to feel better, but we're still in the yellow, then we can have another episode. And this is where that graph kind of drops down, right? And we get up to a better spot, the pain is gone, and then we can have another symptom, and we go up and down and up and down and up and down. That's an avenue. That's more symptom-based care, right? We're never getting to the root of why they're there. We're just helping somebody feel better and then waiting for it to come back again. And again, I just want to make sure I'm going through this with people because, of course, the choice is yours. I'm just the doctor. You're the patient. You're the boss. You're the one making the decisions for your health, for better, for worse. But again, as we go through the opposite side of things, as we correct things, as we move up to the top into the green, it takes less and less care, less and less frequency of coming here to see whether it's me or whether it's Coach Kaysen. We can almost start to put things on cruise control because now your body is out of that fight or flight state. Now we've changed the structure in your spine. Now your body is healing at a higher level. It's functioning at a higher level. So let's go through maybe some examples of that, right? Weight loss. How many of you have tried a diet, lost the weight, and then you stop eating that way that made all those changes, and then what happens, right? The weight just comes right back on. So many people have gone through this cyclical pattern, right? And I think most people can resonate with that. So again, that's more symptom-based care, which we're happy to help you with. I just think it's important that you also understand what getting to the root looks like, right? And for some people, those roots are really shallow, like these cute little succulents that are so popular. I love these little things. Their roots are pretty shallow, as you can see here. Now others, right? Some things that are deeper, that are more chronic, things that you've been dealing with for a long time, sometimes those roots run really deep. And sometimes they're really stubborn to get to, right? And there's lots of layers, if you will. Maybe I should have had a picture of an onion, many layers to get to. So if we're going to the root cause phase, or root cause option number 3 here, I think it's really important people understand this analogy. This is just like putting braces on your teeth. How crazy was the first dentist or what are they called? Orthodontists that told their colleagues that, hey, I can move teeth. I'm sure their colleagues just laughed their butts off, How in the world are you going to change and move bone that's connected to bone inside the mouth? Well, braces are incredible. What an incredible thing, right? Because it's consistency, right? We are putting braces on the teeth little by little, small little changes to move the teeth, right? And once we get the teeth to a spot that we're happy with, what do? We take the braces off. The teeth immediately want to start moving back to what they've been used to for a lifetime. And if we don't make an intervention there with a retainer to hold that progress, we're going to go right back. We used to do talks in groups all the time. I don't do it so much. I'm now doing it digitally. Thanks for joining me here because I've got a family. But I would always ask in a group, how many of you have had braces on and how many of you have had them on more than once? And there was always somebody in the crowd that have talked about, oh yeah, that's me. I didn't wear my retainer to hold the changes. So I had to go back to the dentist or back to the orthodontist and go through those changes again, right? There is a memory that the body has. And it's the same thing in the spine. Right? There's a change, there's a pattern, there's a default that your body wants to have neurologically and structurally. And what we have to do is tip the scales in our favor, right, to offset this old memory, not just with chiropractic, but with PT. If we're choosing this root cause side of things, we have to go through the pain of change, just like in braces, right? Every time you go to the orthodontist, they're tightening those, they're making that little change, and it doesn't feel good on the teeth because we're moving it away from what we've been used to and closer to the position that we're aiming for. And it's the same thing in the body. Now, would you rather have the pain of change, the pain of staying the same, or are you okay with the pain of the change? Most people feel pretty dang good when they get adjusted, but a lot of times we have people where things get worse before it gets better. Now, I'm going to jump back a bunch of slides here, back to this one. You see way in that bottom left-hand corner, you see how somebody actually goes down even lower, right? That's when things get worse before they get better, right? We have to let the body do what it needs to do to make the adaptations away from what it's been used to towards the goal, right? So, that comes with this disclaimer of the pain of change, right? And you heard me bring up PT. We're going to call that physical therapy in our office. We're going to call it spinal rehab. We're going to call it, doing your exercises. But these are things when you're not at the office, it's like the retainer. If the adjustment at the office is the braces, the retainer is you doing your exercises at home. And again, we're going to continue to use the phrase of tipping the scales in our favor. If all that you've been through in life has gotten you to this point where you've lost this curve or there's a scoliosis in your low back, whatever the case is, right? And you have all these symptoms, we've got to do enough of the adjustments and we've got to do enough of your rehab exercises at home to change all that, to rewind all that. And what other factors may apply in your life? How are you sleeping? How are you eating? Are these things helping us? Are these things hurting us? So going through the root cause route, the option number 3, I'm just going to warn you, it's a lot of work. It's not for everybody. It takes a lot of time in the office. It takes a lot of time at home. But what is amazing is that you are handsomely rewarded with a completely different life after it. But the factor is like, how long has it taken to get you here, right? And that's the curveball with everybody that walks in. And going back to feeling good and feeling bad, I think most of us think that here's what happens. Our expectation is that this path of progress and healing and feeling better is just a straight line from point A to point B. And the truth is, there's days where we feel great and days where we feel worse. Days where we feel like we've got it all figured out and days where we don't know what the heck is going on. Nights where we sleep great and nights where we're up all night, right? Healing is not linear. Life is not linear. And I just want to, again, make sure that regardless of what route you take in our office, however we help you, that, just be ready for the curveballs. So are there other things you can do besides chiropractic, right, to take care of your spine and your nerve system? Are there other things you can do besides physical therapy with Coach Kaysen that we just talked about? Of course, there's so many things. So let's contrast the things that we just talked about of the responsibilities that we provide here in our office with the responsibilities that you have at home, okay? And because regardless of what you do here at this office, they can easily be overshadowed by the things you're doing at home. I love this quote, that the doctor of the future is the patient. Like, Coach Kaysen and myself, we are not the ones doing the healing, nor is any other medical practitioner or natural practitioner out there, nor is any pill or any supplement. You are the one doing the healing, right? And the question is, like, are you building health with your daily actions or are you building disease? Really, the choice is yours. Are you stuck in that fight or flight state, or are you doing things to find peace and balance so that doctor inside of you can heal itself? So what are some factors that we can do and factors that we have control on? Well, our food, of course. Every bite that we take can either be the safest form of medicine, right? Or the slowest form of poison. The choice is yours. How about our water? Are we drinking enough? Are we drinking quality water, right? Our products in our house, from our deodorants and our perfumes, our shampoos, all of these things, are they healthy and clean? Or are there ingredients in there that are slowly causing damage as we breathe it in, as we put it on our skin and it soaks into our pores, right? How about our air quality? Not just outside, as it's so easy to see, but inside, right? Are we sleeping, prioritizing our sleep? Are we getting that deep, restful, restorative sleep? Or are we staying up, scrolling on our phones and struggling to get into that deep sleep? How about our movements? For so many of our youth, this is what it looks like on a day-to-day basis. How about our relationships, right? Are they easy, or is there a lot of tension in the relationships that you're surrounded by? Our jobs, our bank accounts, our self-worth. Like, you can see there's so many factors in life that can create a perfect storm of health and wellness, or a perfect storm of fight or flight, sickness, disease that we talked about, right? And for so many of us, as we've painfully said so many times in this talk today, that instead of going back and looking at our relationships or our food or our water or personal care products and our cleaning products, instead of going back and looking at each one of those things, we just covered up with a spoonful of medicine. And it's just, there's a different way if you so choose. Remember, it takes work, but every little thing can move you in the right direction. I love this. Touch is medicine. Not just pills. Sleep is medicine. Breathing is medicine. Nature, getting outside is medicine. Community is medicine. All of these things count. And again, how are you prioritizing those things in your life? So just in closing, couple things. Reminder, if you take nothing else away from this, remember that the brain runs the show. We don't have another treatment, right, on this planet like neurologic treatment that makes as big of a difference. Why? Because every organ in your body is connected to the one under your hat. And when your nerve system is calm, it means that you heal faster. When your nerve system is in balance, it means that you have a better life. That's what you got to remember from this talk. It's just as simple as that. And why is that? Because every organ in your body is connected to the one under your hat. That nerve system is supreme. Everything else is dictated by it. For all of you that walk here or come to us, drive to us, I don't know, I said walk here, right? But our goal is, regardless of what you come here with, it's to build upon what is right rather than what is focus on what is wrong. You are meant to be well, and our job is to get to the root cause of why you're dealing with what you're dealing with. So holy moly, guys, that was a lot. That was a lot. Thank you for joining me. Hopefully you've made it through this whole dang thing. I appreciate you. And hopefully you can see that chiropractic is so much more than what the world says it is, right? The world says it's good for headaches. It's good for low back pain. It's good for a crack and a crunch. And lots of people in the world say that it's not good for anything at all. But we went through a ton of information today to show you that it's good for a lot of other stuff. So reminder that the greatest doctor in the world lives inside each one of you, that you are meant to be well, that true health lives inside of you. And if you're not well, like, let's figure out why. Right? It all starts with that question. So I'm Dr. K. Thank you for joining me today on this long one. If you need anything at all, you can find us here. God bless you guys, and I can't wait to see you in the office.